In this video, we're going to take a look at the health-related social needs and premature mortality dashboard. So beginning in the upper left-hand corner here, we can see a map of the United States, where each of the states are shown in a different shade of blue. Now if we put our cursor over the state here for the state of Wisconsin, we can see that this we can see that the premature age-adjusted mortality rate of 318 per every 100,000 people. So this represents a lower rate of premature mortality. So looking back at the map, we can see those states that are in darker shades of blue have higher premature mortality rates than those states in lighter shades of blue, which have lower rates of premature mortality. And off to the right here, we can see a listing of counties across the United States that are the premature age-adjusted mortality rates. So those states that have, or those counties that have higher rates of premature mortality are listed at the top. And we can scroll down and you can see counties that have lower rates of premature mortality. Putting our cursor over that, we can see information about that county. And again, this is premature mortality rates of per 100,000 people. Now we can see that each of these bars over here, each of the counties, is represented in a different color. And those colors are explained here in this legend, and they are the population types, where metro counties are populations of 50,000 people or more. Non-metro cities are populations between 2,500 but less than 50,000, and non-metro towns are populations that are less than 2,500. And scrolling down here, we can see a couple plots. And here we're taking a look at premature mortality and variables that may affect that. No vehicle, median household income, limited access to healthy food, and preventable hospital stays. So we have these looking at these as potential correlations, and you can see the relationship between those variables and premature mortality. Now going back up to the top here, we can do some filtering. So let's say we wanted to take a look at the state of Colorado. So put your cursor over that and you can see the median premature age-adjusted mortality rate is 336 per every 100,000 people. But if we click on state of Colorado, what that's going to do is it's going to update the dashboard to only include data from Colorado. So here we have all of the counties in Colorado listed in descending order of premature mortality rates. And then our correlations down here at the bottom, we're seeing data that's only from the state of Colorado. So we can see that we can adjust our dashboard to based on the state location. If we click on that state, it will bring all of the data back. Now what we can do next is we can also filter based on population type. So with this drop-down box, we can select just non-metro cities, and the dashboard is going to update and only include data from non-metro cities. So counties that are identified as non-metro cities are the only data that will be included on that, and so we can see across the country, as well as the correlations will include only those population types. And then we can bring everything back by clicking on all, and that will bring back all population types in all states. So this is the health-related social needs and premature mortality dashboard.